Phase 2 study of adjuvant chemotherapy with paclitaxel and nedaplatin for uterine cervical cancer with lymph node metastasis. By Munetaka Takekuma, Mototsugu Shimokawa, Shin Nishio, Hideo Tsutomu Tabata, Yuji Takei, Kaei Nasu, Yoshiyuki Takahashi, Shinji Toyota, Yoshikazu Ichikawa, Atsushi Arakawa, Fuminori Hiroshi Tsubamoto, Taizhuke Mori, Yasuki Hirashima, Kimihiko Ito via Cancer Science. Translate article. Cancer Science, Early View. AdTags, currently, Cancer, Medicine by Alexandros G. Sfakianakis. Abstract. The purpose of this Phase 2 trial was to assess the efficacy and toxicity of paclitaxel and nedaplatin, TN, as the initial postoperative adjuvant chemotherapy for uterine cervical cancer with lymph node metastasis, LNM. Patients with FIGO stage IB1 IIA2 squamous cell carcinoma of the uterine cervix were enrolled. Histological confirmation of LNM was mandatory. Intravenous paclitaxel at 175 mg/m2 and nedaplatin at 80 mg/m2 were administered every 28-day cycle, of which there were 5 cycles after radical hysterectomy. 62 patients were enrolled in the study from November 2011 to July 2015. Their median age was 48.5 years. Range 28?64. The median tumor diameter was 37 mm, 5?64. Overall, 30 patients, 48.4%, had 1 metastatic lymph node, 11, 17.7%, had 2, 3, 4.8%, had 3, 5, 8.1%, had 4, and 13, 21.0%. Had 5 or more. With a median follow-up of 45.7 months, range 23.4 ?69.5, the 2-year relapse-free survival and 2-year overall survival rates were 79.0%, 90%, 69.0%, 86.2%, and 93.5%. 95%, 83.7%, 97.5%, respectively. Almost all adverse events were relatively mild. Grade 3 4 adverse events, NCI CTC ver. 4.0, that occurred in 5% or more of patients were neutropenia, 60.7%, and infection, 6.6%. The proportion of patients who completed 5 cycles of treatment was 90.3%. Postoperative adjuvant chemotherapy with TN for cervical cancer with LNM was demonstrated to be an effective and feasible treatment. A Phase 3 trial is warranted to compare this with concurrent chemoradiotherapy.